A frustrating but common side effect of prednisone is brain fog or confusion. One viewer shared this question. I've been taking prednisone 10 milligrams for about 2 months to help with COPD, emphysema, breathing episodes. It affects my thought process. What can I do to help ease this issue? I take the good with the bad because it helps avoid my breathing episodes. I love that perspective because that's the real thing with prednisone is you take the good with the bad because no matter what, if your doctor prescribed prednisone, it's probably for a really good reason. And if it's not, then don't take it. But let's talk about brain fog, confusion, what prednisone might be doing to cause it, and some things you might be able to do to minimize the impact on you to have your experience while taking prednisone be as pleasant as possible. Because I'm Dr. Megan, your prednisone pharmacist, here to help you not just survive prednisone, but also to thrive while taking prednisone. So, prednisone is an anti-inflammatory medication designed to mimic our body's naturally occurring hormone called cortisol. While it's really effective for inflammatory conditions like COPD, emphysema, asthma, rheumatoid arthritis, it can also disrupt the balance of hormones and chemicals in your brain. Here's what's happening. First, there's hormonal disruption. Prednisone's interfering with your normal cortisol rhythm. It's called your HPA axis, your hypothalamic pituitary adrenal axis. Prednisone's basically turning off this whole adrenal cortisol system. That means your natural cortisol rhythm. Cortisol, your body makes it early in the morning, releases it. And that's part of the way you wake up. You have the energy to wake up, and then it's sending signals to other places in your body to help keep this rhythm of day and night, awake and asleep, to be normal and steady. Prednisone is 10, 20, or 100 times stronger than that normal amount of cortisol. So it's just throwing off that gentle rhythm. That affects your energy, your focus, and your mood. Next, prednisone is affecting your blood sugar. So the whole class of drugs that prednisone is a part of is called glucocorticoid. Gluco meaning glucose, meaning sugar. It's affecting how your body deals with sugar, and it can lead to blood sugar fluctuations. Sometimes when you have super high or super low blood sugar, it can make your brain a little fuzzy. And in fact, people who are diabetics reliant on insulin, their family members know that when mom or whoever it is with the diabetes suddenly gets confused and starts talking weird, that she's probably experiencing a hypoglycemic episode and needs emergency treatment. The increased blood sugar can lead to mental fatigue, difficulty concentrating, and mood swings. Essentially, when you have lots of sugar in your blood, instead of having a fluid to pump through your blood vessels that's normal and closer to the texture of water, it's got lots of sugar in it. So it's becoming thicker and more viscous, closer to the texture of honey. And that's harder for your body to do. It's harder to get the right balance. Third, prednisone is causing sleep disturbances. One dose of another steroid called dexamethasone was enough to completely disrupt the circadian rhythm, causing suppression of your sleep hormones like melatonin. It makes sense that insomnia is the number one tweeted side effect of prednisone because it's so often causing this sleep issue, insomnia, nightmares, lack of restful sleep. And poor sleep is definitely associated with brain fog. It's really hard to have a clear memory and, recall of people's names or where you left something if you're not getting restful sleep. Just ask any mom with a newborn. And finally, long-term prednisone use can actually shrink your brain. I have a whole video all about the impacts of prednisone on your brain and the fact that it's shrinking it. So check that out if you want to dive deeper into that topic. So what can you do to ease prednisone causing brain fog? The first thing you can do is to keep your blood sugar stable. Eat a diet that is minimal in high glycemic index foods. Simple sugars, refined foods, ultra-processed foods are not the greatest choice on prednisone if your goal is to minimize brain fog. You want to eat a diet with good protein, good fat, and whole grains, fruits, and vegetables, all balanced together so that there aren't moments of straight carbs that can lead to blood sugar fluctuations. Eating smaller meals throughout the day is another method that you can use to stabilize blood sugars. Next, you need to stabilize your brain with key nutrients. Prednisone is stealing nutrients from your body that may contribute to worsen brain fog. Prednisone is stealing magnesium, and magnesium is vital in 300 biochemical reactions, many of which have to do with your brain and your circadian rhythm. For example, you need magnesium in order to make melatonin, your sleep vampire hormone. Magnesium also supports brain function, reduces stress, and improves sleep. So supplementing with magnesium, my favorite kind is glycinate because that also helps with your brain function. And you need about 200 to 400 milligrams a day. Next are B vitamins. B vitamins are really important for energy, for helping your brain use the energy available for it. And so you want to make sure you're getting enough B vitamins in your diet and in supplementing. Things like vitamin B6, B1, B2, B3, and B12. Finally, when it comes to your brain, you can't have a conversation about brain health and optimizing it without talking about fish oil. Omega-3 fatty acids are the building blocks of neurons, nerve conduction, and you've got to have enough of that in your diet or as a supplement. Eating fatty foods like salmon is a great idea, but if you can't, you don't live near fresh sources of that food, you can supplement. My favorite kind is Nordic Naturals Pro Omega D. Not only does it have responsibly caught fish that are minimal toxins like mercury, but it also has vitamin D in there to help support your brain as well. The next thing you can do is improve your sleep quality. I have a whole video about what you can do to improve your sleep quality if you want to dive deeper into that. But minimizing this modern lifestyle that we have with electricity and bright lights late into the night and going back to what your ancestors would have done is one simple thing you can do. Try to stay mentally active. Try doing puzzles, keep working, keep communicating with people, reading, learning something new, and then getting exercise. All of those can truly help your brain. So some things that can worsen brain fog are stress and emotional challenges. So try to practice mindfulness, breathing exercises, yoga, things that help you feel calm and restful. Stay hydrated and talk to your doctor if it's getting worse and if there might be another explanation. Maybe you can go on alternative medication to prednisone or something for your COPD. So to summarize, brain fog is a well-known side effect of prednisone, and it's usually worse at the higher doses. And there are things you can do, like stabilizing your blood sugar and getting good sleep to minimize the impact of brain fog on you while taking prednisone. If you want more tips of how to minimize the impact of prednisone on you, to feel like yourself again while taking prednisone, I have a prednisone checklist, and it includes evidence-based tips to help you know exactly what to do to minimize complications from taking prednisone. Just click the link below to download it now. Signing off is Dr. Megan, your prednisone pharmacist.